Hello, hello, hello. Hello, Facebook. Hello, YouTube. This is Dr. Nicole Bramwell, hailing from Florida. And I just want to say hello, happy Monday, happy President's Day. If you're chilling at home, that's awesome. Hopefully, if you have a business or something or you have a passion, that you are using this time wisely to address that and to do something toward it. But I wanted to share, I've been wanting to share about something with you that I think that is probably overlooked. I think we've heard bits and pieces of it. We talk about medication and hearing the advertisements, the ads on the television or even on the radio, and that the information about the side effects is longer than the information about the product, about the medication. And I wanted to share because I think that a lot of people don't know the things that can increase your likelihood of having the side effects, of experiencing side effects. And so I'm going to share the 7 most common factors that increase medication side effects. Okay. And some of them will be obvious and some of them maybe you don't know, but I'm going to put them all right here so that you have them. All right. I've been a medical doctor. I've had my medical degree for 31 plus years, going into the 32nd year. And I've seen a lot. I was a pediatrician for 20 plus years, board certified pediatrician for 20 plus years. And I morphed into holistic and naturopathic wellness to help people, first of all, to create more time to be able to discuss those things with people. So I am still doing that. I help a large group of the people that I help with my coaching tend to be women that are perimenopausal, menopausal, postmenopausal, that have insulin resistance or diabetes. However, I've been able to expand that over my studying of naturopathic uh, uh, information, being certified as a naturopathic practitioner, and also just my self study on investigating things and just things I've learned from my clients and just all sorts of stuff, studying, always learning, because that's the only way that we can help people. So I'm excited about that I've moved into this realm, and I've even moved into a realm of no ingredients. So natural supplements, yes, and those have their place as far as getting proper nutrients, and definitely medications have their place. However, our society is definitely over medicated, right? I think all of us would agree with that. So I am going to cover these 7 most common factors that increase medication side effects. And so you should ask your doctor questions if these things come up for you. I don't know how many medications you are on, but recent research shows that anyone age 50 to 64, which tends to be the ladies that I take care of in my wellness coaching, they have 13 prescriptions on an average. On an average, 13 prescriptions per year. That's a lot. Those are different prescriptions, not this just refilling. Those are different prescriptions that are prescribed. And at the age of 80, though, that number of prescriptions actually increases to 22. Now, it gets more difficult to keep up with things as you're getting older. And so, can you imagine trying to keep up with 22 prescriptions? And unfortunately, because they may have gone to a different doctor and what have you, some of those actually may be duplicated, but there's a separate prescription from a different doctor, right? So, we certainly need to help our loved ones keep track if you know that they're on a lot of medications, or even if they're not, because the average American actually has gotten at least 4 prescriptions for the year. So that's on average, just overall, for whatever reasons. Okay. So I want you to know that also men actually, um, 54% are on multiple medications. 62% of women are on multiple medications, and women, you actually start getting prescriptions earlier, sooner, which means you're on them longer. And that goes into one of the reasons that you may have increased likelihood of side effects. So let's start with the obvious. Polypharmacy, that's what it's called, but taking multiple medications, that is what that is. So drug to drug reaction and interactions with drugs, the drug interacting with another drug will increase the likelihood of side effects. They may have the same side effect profile, which means they may cause the same type of side effects. So if you're taking two of the drugs that do that, guess what? You're probably going to have that side effect, or you're more likely to. Okay, so I don't want to doom you to that, but that makes it more likely. And the common issues for that would be dizziness, confusion, falls, liver overload. That's a big concern, and altered absorption of the drug. So the drug may not be as effective, or very commonly, one drug may be competing with the absorption or the metabolism and actually increase the concentration of the drug in your blood because it's slower to be metabolized or absorbed. So that means you keep more of that drug in your system for longer. It takes longer to clear out of your system. So another drug may be causing that. So we don't want to do that. And who's in high risk? Women, you keep coming up, 40 plus, okay? 40 plus for the issues of blood pressure, cholesterol, and diabetes and mood. All right, did you hear that? Those are very, very common. And so I need for you to pay attention to that for sure. I'm trying to see my comments, actually. Let me do this. Oh, no, I don't want to do that. So I see that you all are on there, but I can't see your comments yet. So I'll figure it out. But either way, keep putting your comments. I'll see them later, and I can always respond, okay? So definitely, if you have any questions, go ahead and drop them in the comments. Maybe it's because you haven't done any comments yet and I don't see them. All right, so this is number 2. So after multiple medications at the same time, that's one of the causes of side effect increase in side effects. Then poor liver function. So a lot of medications actually get cleared through the liver. And so the liver is responsible for detoxifying the body just in general, but detoxifying medications. And again, if you have competing medications, then that may be a slower process for the liver. It may overwhelm the liver. And if you already have poor liver function for whatever reason, whether it be to a chronic illness or caused from another medication, then it's going to respond sluggishly, and it's going to accumulate, like I told you, and then you're going to actually have more of the drug in the medication in your system, and that can cause issues. So what can impair the liver function? Fatty liver. So we have fatty liver that is alcoholic. So due to alcohol consumption, excessive alcohol consumption or abuse of alcohol, okay, but also non-alcoholic fatty liver, which is very common, and it can be the first thing that is actually seen in diabetes as a precursor to your blood sugar changing in your labs and what have you. So fatty liver, alcohol use, like I said, high sugar, fructose intake, that can also challenge, and also chronic inflammation. Okay, so they last longer and they may even be more severe, the side effects. So please, please, please know what you're taking. If you don't understand what you're taking, why you're taking it, please ask your doctor. All right. If you're not getting the answers, you need to make sure that you figure out a way to get the answers. So ask questions. Definitely write down questions before you go to your appointments. That will make your appointment more efficient. You may even want to set, if your doctor has the ability for you to email to them, you may want to email your questions to them so that maybe they can answer them. And again, your visit will be more efficient. That puts less load on that whole patient load in the doctor's office and will make your visit way more pleasant, the more that you can get out in front of that. All right. Then kidney impairment. That's huge, huge, huge. Either kidney impairment or dehydration. Unfortunately, dehydration actually it affects the kidneys. So it kind of shows up as a temporary kidney impairment if you're not hydrated. So chronic dehydration, diabetes, there's that again. High blood pressure, there's that again. And then aging, because kidney function may lessen as you get older. But again, if you're on multiple medications or you have any of these conditions, that kind of accelerates that. So your body age, your metabolic age may be a little bit higher than your actual chronological age. Okay, so we need to take care of ourselves. So drugs, again, this a common build up in the kidneys and can actually shut the kidneys down, can damage your kidneys either temporarily or permanently. So you need to know what you're taking, but also make sure you're hydrating. Many people live on the edge of dehydration. You don't drink enough water. You say you don't like water and what have you. And unfortunately, other fluids don't really hydrate you. All right. Even natural juices, because they still have sugar and what we would call solute. So that's still taking up some of the water that would get into your system. So drinking plain water throughout the day, please drink water, not just one bottle. That's not enough. Your body is 70 to 80% water. So you can imagine that one bottle is probably not going to keep you hydrated. And not only your skin and what you can see, but also inside your cells. Your cells need to be hydrated. They need to have enough fluid to stay hydrated to do the functions that they're supposed to do. Okay. And so you can set yourself up for electrolyte imbalances. So the salts in your body can be out of whack because the fluid in your body is out of whack and they follow each other. They determine what the other one does. Okay. Hormonal changes. Perimenopause and menopause. Here we are again, ladies. I'm so sorry. I feel like I'm beating up on you, but I don't know if anyone that's ever taken birth control, you heard that, if you're taking antibiotics, birth control, you need to use extra protection because the hormones in the birth control, are affected by the antibiotics. So then it's less effective, right? So then you needed to use more protection. So same would be estrogen affects drug metabolism, okay, and receptor sensitivity. So that means like accepting the drug. And so it can be increased sensitivity or decreased sensitivity, right? Increased sensitivity to antidepressants. So again, sedatives and blood pressure medicine. So you could actually drop super low with your blood pressure medicine. You may accumulate side effects with your antidepressants, be more sensitive to them. And so just be careful. Greater risk of weight gain and fluid retention with these hormonal changes, and that can change how you metabolize, and then heightened mood related side effects. Okay. So if you notice or somebody else notices that you're becoming more irritable, or if you're more depressed than what would be deemed as your normal or your routine, then you kind of need to pay attention to that. Okay. And go talk to your doctor. All right. Nutrient deficiencies. This is common too, because some medications actually make your body metabolize other nutrients more. So say metformin. Metformin is very commonly used medication for diabetes, and it actually can deplete your B12. And so when you have your blood tests and what have you, make sure that your doctor is checking your B12 periodically, or that you're on a supplementation, because that can actually deplete that. Magnesium can be depleted and affected. If you're on statins and what have you, need to be mindful of muscle cramps. Those can get pretty severe, and you can have severe side effects with the statins, which are for cholesterol. CoQ10 depletion from the statins that I just talked about, so muscle pain, weakness. And so if you have changes, don't just write things off. Don't just go lie down and say, oh, it'll be better. If you had a change in your medications, or even if you've been on something, or you had an increase in the dosage, what have you, because increase in dosage and longer time of an increased dosage then increases your side effect profile as well. Okay. B vitamins are very affected. You can get neuropathy. Neuropathy can worsen, and fatigue. So again, pay attention to your B12 if you're having any of those symptoms, and not just B12. Any of your B vitamins can be affected by different medications. So please, please, please talk to your doctor. Gut health and microbiome imbalance. That again, the gut influences the absorption of the drug, and also immune reactions, because a large part of your immune system is in where your gut. So increased GI side effects, so like diarrhea, constipation for some, just achiness, just not feeling well, nausea, all of that can occur if you have poor gut health. So your gut needs to be, so this is kind of a catch-22, because is your gut healthy? Are you healthy? Are your conditions under control? All those types of things tie into whether or not you're having the effect of more side effects. Okay, inflammation and autoimmune flares; those can also make the microbiome out of whack and put you out of balance, and certainly increase. So, common triggers: antibiotics, processed foods, and chronic stress. Okay, stress is at the top of the list pretty much for everything. All right, and then that's where we're going to end. Is number 7 is chronic stress and elevated cortisol, because that's what happens. Your body stays in fight or flight. Your body's not made to stay in fight or flight for long periods of time. Your body was meant to experience stress and then recover, and experience stress and recover. And unfortunately, we don't live in that kind of society anymore. So, personally, I do things that are going to help me with that. And I'll talk about that in just a second. But stress alters metabolism, blood flow, and your nervous system sensitivity. So, hey, nervous system tops everything, because your nervous system starts with your brain, and your brain is supposed to control everything. Unfortunately, when you have any of these conditions and you've been having pain or stress or different chronic illnesses, guess what's controlling you? Whatever your response is in your body, however you feel from that. If you don't feel well because your blood pressure is elevated, if you wake up in pain, you're being governed by your pain rather than your brain doing what it's supposed to do to tell your body what to do. So heightened perception of side effects. So yeah, if you're stressed, then you're kind of going to try to focus on something that takes you away from the stress. And unfortunately, it may not be something good. It may be that now you're focused in more on your pain. Your pain becomes more evident to you. And then so it feels like it's exacerbated. It feels like it's worse. And pain is real, and it's also subjective. So your, how you perceive your pain and how I perceive my pain are different. And so everyone has their own. So we can't tell somebody that their pain isn't real. Their pain is real to them, and they have their own scale. And that's why we do the scale, to see where people are, because different people, everyone is different. So someone may say my pain is a 7, and I'd be okay if my pain went down to a 3 or a 2. Somebody else might say my pain is a 5, but I don't want any pain. I don't want to feel any pain. So, those are things we need to pay attention to. So please don't blow anybody off. Probably lots of other things going on. We don't all show or tell what's happening in our lives that's stressing us out. Many of us keep it bottled in, which unfortunately then makes the effects on the internal body systems heavier. So increased blood pressure and glucose fluctuations, definitely, that's something I think that is overlooked a lot, that chronic stress actually can keep your blood sugar up. But then it also leads to other things. It can lead to you not making good food choices, which will also keep your blood sugar up. But it's not always that. It could just be the stress, because then cortisol is elevated, and that goes down that cascade of increasing your blood sugar, and it can stay up for a long time. If you have pain, chronic pain can also cause you to have increased blood pressure and increased blood sugar. So do not overlook these things, okay? And then sleep disruption from medications, or just sleep disruption in general because of the stress. And so your nervous system is out of balance, it's dysregulated. And so that will amplify the side effects of medications as well, because you're just completely out of balance, and your body can't help you right it until you put it back in balance. So very quickly, not quickly. What I want to tell you is that personally, what I'm using is something that has no medications in it. And I'm not saying to stop your medication. So please don't go say Dr. Bramwell said to stop taking your medications. What I'm saying is to start this without adding more medication to your current regimen, which is Super Patch. It is a FDA registered class 1 medical device. that happens to be a patch, very simple peel and stick patch. It has a pattern on it. I have to show you here. I'm going to take this off and show you because I didn't bring my patches over here. But here, so here's my peace patch, my favorite patch. All right, so the peace patch, it has a pattern on it, looks much like a fingerprint. Okay, you see that? And for the peace patch, it helps with stress and anxiety and quieting down of the dysynchronous nerves, because when you're under stress, your nerves are not firing together. They're not working well together. They're not doing teamwork very well. And so when this quiets them down, then your body can actually give itself better signals. Okay. We've got 15 of these devices. We have for pain and inflammation. We have for balance and stability, which those are the biomarkers for longevity. So if you want to live longer, hey, you probably want to get on the Liberty patch. That is our foundational patch. It also creates homeostasis of your autonomic nervous system so that you can, your breathing, your blood pressure, your heart rate, all of those things can be in better balance. And then everything else can follow. And so the patches work very well together. So we use the Liberty patch as the foundational patch, and then the other patches then can respond, can send the signal better to the brain, and then your brain can be in charge again and tell your body what to do. Okay, so balance and stability are extremely, extremely important. 36 million Americans fall in the elderly population every year. I'm sorry. That would be astronomical, but it's still astronomical. 36 million is a high number. All right. We have for sleep, we have for focus. Now we have our Zen, which is for cognitive harmony and clarity, and it will increase your intuitive nature, your creativity. So this is Zen. And again, a disclaimer that none of our patches are for medical purposes. However, they are used and can help in augmenting wellness. Okay, so that's where we're headed. So, what I want to ask you is, what's the number one thing that you want to ask your body to do for you? Is it to be more energetic? Is it to have less pain? Is it to be more focused? Is it being able to think clearer? Is it being able to have peace and less stress? Is it to have joy, because we have a joy patch for mood? Is it to kick any habits, because we have Kick It, to kick habits? Yes, to rewire your brain so that you can actually kick habits. And I'm talking all types of habits. Okay. So our 15 patches, we've got one Ignite that can burn up to 500 calories. You can burn up to 500 calories per day with the Ignite patch, because it raises your basal metabolic rate. So that's at rest. That's your metabolism at rest is being raised now so that you can actually burn more calories. We want to encourage exercise, but you definitely don't have to go out there killing yourself with exercise in order to get your metabolism to go up. And actually, just a little hint, if you exercise too much, your weight actually goes up, and it's not just because you're putting on muscle. Okay. The studies show it, that if you exercise too much while you're trying to release weight, you're actually going to gain weight, and you're not going to be happy about that. So please stop all that excessive exercising. Stop the 2 and 3 hours of exercise. Unless you're a trainer, you really shouldn't be doing that. Okay, and trainers usually can keep up with it with their nutrition and what have you. But usually, if you're trying to release weight, you're actually pulling back on your nutrition, and you don't have it balanced, and then you're over exercising, and your body is trying to find what? Again, balance. All right, we've got the Rocket, which is for sexual health. All right, guys, but also for women, and it also helps you with some things. We've found testimonials with the ladies that it helps us in perimenopause, menopause, and postmenopause. All right, so we have several others. If you want any of them, please reach out to me. I've been on here longer than I wanted to, or that I thought I was going to be on here, but I wanted to give that information to you about the 7 most common factors in increasing side effects of medication. So hopefully that's helpful. If you have any questions, please send to me. Go ahead. Hey, Bobby, how you doing? You're still with, oh, well, we can certainly help you. Actually, our other new patch, the Assure, helps with dizziness, but we've also had some benefit with the Liberty, where people have had vertigo or dizziness, and the Liberty. So let's talk, Bobby. I'll reach out to you after I'm done. And thanks for jumping on. And I appreciate everybody else that is watching. So again, if you have any questions, please drop them in my comments. I'll go back, I'll look at them, I'll give you an answer. You can hit me up in Facebook Messenger. And if you can also text me directly, 407-674-5725. Thank you. All right, this is Dr. Nicole Bramwell, and I am signing off for now, and I'll bring you more information soon. Take care.